What are varicose veins? Commonly, people know them as those big, tortuous green veins that they see in the legs, especially in the calves or around the ankles. And you may have noticed them when people walk by you, and they get worse when they stand for long periods of time. But in reality, varicose veins are a spectrum of disease ranging from early stages where they're spider or thread veins, bluish small light ones. They're less than 1 millimeter in size, but usually a patch. And they can range in either extreme in severe cases where they're non-healing ulcers along the medial side of the ankle or the inside of the ankle. These are known as venous ulcers. Along the way, some patients may also experience some leg swelling, some skin changes and pigmentation like brownish coloration and itching. The main underlying reason is something known as venous reflux. This is a condition where the valves in these veins are not working too well. As a result, they allow blood to backflow and pool downwards towards the legs. Now, as you may be aware, veins transmit blood back to the heart, and they usually go against gravity if you think about it. And so inside they have these one-way unidirectional valves. In venous reflux disease and varicose veins, these valves are not working and they allow blood to pool backwards and flow back down. And this triggers all the symptoms that I've described. And these include pain and aching on standing for long periods, swelling around the ankle and dorsum of the foot, itchiness around the ankle, pigmentation, and formation of ulcers. The people at risk are people whose job requires them to stand for long periods of time, such as teachers, people in the retail industry, people who are obese or overweight and they add pressure on their legs. Women are also at increased risk because of pregnancy. We know that women with 2 or more children are increased risk of varicose vein formation. And also rarely in a group of patients who have had previous episodes of deep venous thrombosis. One last category that we sometimes see are patients with a familial tendency. That is, the whole family has a history of varicose veins, their siblings or their parents, and they are increased risk as such. Now, how do we diagnose varicose veins? Aside from a clinical examination in which we see dilated green tortuous veins or spider reticular veins or non-healing ulcers, we like to use an ultrasound scan. That tells us which of the veins are particularly affected by the condition and also guides our treatment. And that is an almost non-surgical method known as endovenous vein ablation. In this procedure, patients come in the morning, they're given very light sedation and sometimes even local anesthesia is enough. And under ultrasound guide, we make a small injection into the affected veins. And then what we do is we either pass a heater probe, known as a radio frequency probe, or sometimes a tube that allows us to deliver glue. So using one of these two methods, a heater probe or the glue, we seal and close off the affected veins so that it does not flow back down. It's as simple as that. Now, patients do this under sedation and local anesthesia. They recover very quickly, and many patients go back within 6 hours of the procedure on the same day and they walk home. They are expected, and many also continue to start their exercises again after 3 days, and strenuous activities like marathon running or hiking or climbing after about a week. We of course do give some medication to help with any initial post-surgery discomfort, but we don't expect them to have a lot of pain. And then we also give creams for cosmetic purposes, especially over the tiny scar site where the catheter was inserted. I hope the information I provided helps you understand varicose veins better. Thank you very much.